Hello, everybody. My name is Michel Bosiers. I'm a vascular surgeon at the University Hospital Bern in Switzerland. And we're going to discuss today the one-year results of a new bioresorbable drug-eluting scaffold called the MOTIV by Riva Medical for the use in BTK lesions. So after gaining its CE marked approval, we wanted to check how it works in real life. So we wanted to see its efficacy and its safety in a post-market clinical trial. So the MOTIV Scaffold is a bioresorbable drug-eluting scaffold. It has the drug sirolimus bounded to it. And in regards to the other devices out there which are bioresorbable, the polymer is called Tyrocore, which is a proprietary bioresorbable polymer and is derived from the tyrosine amino acid. It's also iodine bounded, so it's more visible than the other devices on the market. And if we compare it to poly-L-lactic acid, it's actually twice as strong and 10 times more ductile. And what's another great feature is that the problem in the past was that all these devices had thick struts. So they managed to have really thin struts and without losing their radial force. So at the moment, they have the highest radial strength on the market available. The study design was that we did a prospective single-arm multi-center study. We enrolled 58 patients with 60 study limbs, and we wanted to do the follow-up until 3 years after implantation. We only included patients with Rutherford 4 and 5, so a real-world critical limb ischemia population. And we were able to treat de novo lesions or restenotic lesions after PTA. And what was also great about it, that you could treat the entire length of the, for example, tibial posterior artery, but the total length of stenting couldn't be longer than 10 centimeters. We had 84% males, and we had 66% diabetes. So the primary endpoint regarding vessel patency was 88.3% after 12 months. We also had a 99% technical success rate. We had excellent tracking and visibility during implantation. We were able also to implant multiple scaffolds in the same patient with precise placement. And we have seen no delivery or no device-related complications whatsoever. There was one patient with a clinical driven TLR of those 58 patients. So excellent results with great improvement in Rutherford classification and wound healing as well. Well, I think we now need to see it in larger trials, in randomized controlled trials, and that's a good thing that it's already on its way. So Riva Medical is conducting the BTK randomized controlled trial, which will be a prospective multi-center single-blinded randomized controlled trial comparing MOTIV versus POBA. They want to include 292 patients, also again with Rutherford 4 and 5, so no Rutherford stage 3 or 6, with a total lesion length up to 120 millimeters, and also we can treat 2 different kind of arteries. And they exclude, of course, severe calcified patients. So I think this is a big step forward. And then the next step would be, of course, to compare these results with the classic drug-eluting stents that we nowadays use in BTK lesions.